This lecture will be on calcium in hard tissues, focusing on calcium metabolism. So the text is chapter 25 of medical biochemistry, and most of the questions, or all the questions, will come out of either the text or off of these slides. So we'll start off by talking about bone structure and remodeling, talk a little bit about tooth structure, and then really get into the calcium metabolism and the role that bone plays in that. So as you well know, bone is a structural material. The mineral content provides stiffness and hardness to both bone and to the tooth structure. And the bone structure and health is really important, not just overall, but for many issues in dentistry, such as the placement of implants, orthodontics, so the movement of teeth through the bones, perio-related issues, and in oral surgery. So bone also serves as a calcium reservoir. So even though it has been often thought of as an inert structural part of the body, it actually is biologically and metabolically very active. So this is just a chart that shows how bone interacts with as a calcium reservoir in the body. So as you increase bone mass, you can see you decrease the serum calcium, and that in turn leads to bone resorption, which is a decrease in bone mass, which increases the serum calcium, which leads to bone synthesis and an increase in bone mass, and so this entire cycle kind of feeds back on itself. And the whole point is to maintain this homeostasis. So there's a constant push and pull between the bone synthesis and the bone resorption that is regulated by the serum calcium, and so the maintaining of this is really important to maintaining the health of the bone. So the composition of bone is composed of collagen, which is the polymeric component, and hydroxyapatite, which is their inorganic crystals. So it is a composite. So like what we've talked about in the dental materials course, it is a combination of a polymeric material and a hard, rigid, inorganic material, in this case hydroxyapatite. And roughly 50% of the bone is hydroxyapatite plates. And this is just showing some of the microstructure of the bone, and there are different kinds of bone, and that bone is highly vascularized, and there's the main components of trabecular bone, and an interstitial bone, but there are many different kinds of bone. Depending on who you ask, people will say there's up to 10 to 12 different kinds of bone. We're really not going to be talking about that in particular detail, but based on the morphology and the biological activity, there are different kinds of classifications of bone within the body. So contrast this a little bit with the composition of tooth structure, and I know you've been over this in karyology, but it's worth just kind of reviewing that again in terms of the contrast between bone and tooth structure. So in enamel, the matrix is amelogenin. 90% of that is of the inorganic component is hydroxyapatite. So again, this is a composite material made of amelogenin polymeric material and the hydroxyapatite crystals. Dentin is also a composite. The polymeric matrix is collagen, with the inorganic component being hydroxyapatite. And this is just showing the microstructure of the enamel. And similar structures happen in bone as well. The crystals are of the hydroxyapatite are organized into larger rods, and then the rods themselves organize into the enamel structure. And this is what gives both the hard tissues of the body, the teeth and bone, both its hardness and its crack resistance or its toughness. So enamel and bone are both rigid materials that also have a lot of toughness, which is a difficult combination to find in synthetic materials, but it is characteristic of both enamel, dentin, and bone. So why a composite structure? This is to reiterate some of the things that we had talked about in the past in the biomaterials lectures. So composites are a combination of ideally the best of two materials. So collagen is a tough material but not strong, and hydroxyapatite is a strong material but not tough. So it is the inorganic component of that. And mineralized tissue is both strong and tough. So it has really achieved that synergy that has been very challenging in synthetic materials. But it is because of the microstructure of the crystals and how it is self-assembled within the rods of the enamel and in the bone. It is it is a combination of both strong and tough. And the structural integrity of bone and all the hard tissue is dependent on this interaction between the collagen and the hydroxyapatite and the microstructure that's formed. So there's some differences between bone and teeth. Bone has, in general, a lower mineral content. Bone is maintained and enamel is not maintained. Bone is very biologically active. It can heal. Enamel cannot. Dentin has a limited capacity to heal, but in general, it is not. It's certainly not as biologically active as bone. And bone is highly vascularized. So one of the important parts of bone health is in implantology. So as you can see from this picture here, an implant is placed into the jaw, and then you have the abutment and eventually the crown on top, and the health of the bone is really important to the overall stability and the longevity of the implant. If the bone is weak or there's not enough bone, it'll be very difficult, if not impossible, to place the implant or to have it last over time. And the ability for this implant to transmit force onto the bone will also help to maintain the bone health as well. So this is just some literature that talks about the importance of bone density in terms of the survivability of implants. And this is talking about how implants in patients with low bone density are possible, but they require precautions. And basically, it's very important to have good bone health, because often you have to graft or have bone substitutes in order to build up the bone in certain cases if there's not enough. So it's really important to have maintain good bone health. And this is also true of if a patient is taking bisphosphonates. It's not really clear if there is a higher risk of the dental implant failure, but this also plays into the idea that bone health is important for the longevity and the success of implants. And also, the implant itself needs to be is directly into contact with the bone, so the transmission of forces and the biocompatibility of the implant also play into the idea of having good bone health. So in order there has to be initially healthy bone, and the implant has to allow the bone to maintain its structure. So this is some of the importance of bone and bone biology in terms of maintaining an implant. And this is true for a lot of aspects of dentistry where bone is involved, that it's really how to maintain the health of the bone in terms of the success of the clinical procedure. And this is just showing some important parts that play into bone integrity. So in the development process, you have what is important in terms of bone integrity is the mineralization process, and that has to do with the collagen structure and the calcium homeostasis. Osteogenesis imperfecta is a genetic problem that results in a misformed collagen structure, which can affect the mineralization process, which results in poor bone integrity. From a maintenance process, which is what we're going to be primarily interested in, this is basically how the remodeling affects bone integrity. So the calcium homeostasis is important in maintaining the remodeling process, which maintains the bone integrity. And disease and processes, which we'll talk about, can also affect this remodeling process and affect the bone integrity as well. So what we're really going to be talking about is how the calcium homeostasis and how disease processes can affect the remodeling process, which will ultimately affect the bone integrity.